Do you plan your life and your activities around neck or back pain? Do you struggle in pain until you can maybe take another pill or get another injection in your back? Are you frustrated because it seems your doctor just doesn't seem to have any other options for pain relief? Are you scared maybe that you'll never get rid of the pain? Well, our expert in neck and back pain, Dr. Miller, is here along with the patient, Julie, to talk about the options that you really may need to consider if you answered yes to any of those questions. Welcome to 8 West, Julie, and welcome back, Dr. Miller. So let's talk about this. Those questions, if anybody can answer yes to those, they must have a miserable life going on.
Absolutely. And, it's very frustrating for a lot of those patients, Terry, because they're in pain. It affects their quality of life and their ability to function. And a lot of the treatments that are recommended, like you mentioned, revolve around symptom relief and just basically trying to mask the pain temporarily. And when you take that approach, you're not really fixing the cause of that pain. And a lot of times with spinal degeneration, the condition worsens over time. You're just masking it. And that's why they never really see an end in sight, because they're just, the focus is mask the symptoms. If you really want a way out of that and, change your life and be able to live a normal life again, it's very important that you go to work on fixing the cause of that pain and not just continuously masking the pain.
Yeah, I was going to ask you, well, you were just answering that question. So because you're masking the symptoms of the pain, does that degeneration just continue to get even worse? So then you're even in a worse state? I know you have the models here where you demonstrate exactly what's going on.
Yeah, and that's a good point you make. Pain, as uncomfortable as it can be and painful it is, it's happening for a reason. It's our body's way of telling us to stop that activity or get out of that position, because if you keep doing that, you make the condition worse. So when people try to override that pain cycle with the drugs, the shots, or even at times surgery, they don't really notice the pain because it's been masked. So then they do these life activities they normally couldn't do, and it just wears it out even quicker. But what a lot of patients are dealing with those chronic conditions actually is degenerative disc disease, where these pads and spacers should be like a wet sponge. They're very thick. You can see how shock absorbing that is. And the nerves coming out in this condition have plenty of space. They're not pinched. But with stresses in our life and neglect, these discs will dry out and degenerate. And you can see how much thinner this disc is than the normal. And as the bones get closer together, it encroaches and starts pinching the nerves. Also, you can see how very brittle and rigid that disc is, like a dried out sponge. So when they're trying to do activities and walk and bend and move, they don't have that shock absorption, and it just keeps jolting that area of the spine and inflames and affects the nerves. Another condition, as the discs degenerate and get brittle and hard, that could occur is an actual bulge or a herniation of the disc, where they literally tear, and as the pressure builds, they'll start pushing back into those nerves. And again, these are very painful conditions. It can cause neck or back pain, but also, as we said before, it can affect extremities, where it can go into the arms or hands, down to the legs or feet, and really affect their ability to live a normal life.
Yeah, and you even put people at a risk for falling or any other kind of injury. So Julie, exactly what was your story?
Just having a lot of back pain for about 7 years, and saw Dr. Miller on TV many times with you on 8 West, and was driving by one day after visiting the pain clinic. I got shots and did physical therapy and different things, and decided to give them a call and see what they could do for me.
Yeah, what was her diagnosis, Dr. Miller?
So as we spoke, she had pain in her neck and lower back, and also radiating issues into her arms. Julia had an MRI done, and so we looked at that, and this is of her lower back. But the white strip going down the middle of the screen is her spinal cord and nerves. The squares down towards the left are the vertebrae, and then the arrows are pointing at the lower discs that are L4 and L5. You can see those discs kind of pushing towards the right into those arrows. She had bulging discs in her lower back that were pinching those nerves, and so she had degenerative disc disease and bulging discs. That's why she was hurting, and like she said, she was doing medications or the shots.
Right.
Even did a RFA or a rhizotomy, where they try to burn her nerves and just kill them so she didn't feel the pain. But like she said, it was 7 years of struggling, and happy that she found us so we could help her out.
Yeah, so what was the timeline? How quickly were you able to get some relief from that pain after seeing Dr. Miller?
After the second or third visit with him, I was feeling much better, and it's like, wow, some of the pain is gone. you know, and I was able to do more stuff around the house and get out and do some yard work. And I do a lot of sewing, so I was able to do a lot more sewing, and it's been awesome.
And so for the relief that you were able to see, there's a beginning, middle, and end to the treatment. It's not an ongoing process for you, is it?
I am still going to see him once a week right now for traction because of this. Just
unrelated to the back issue.
Unrelated to the back issues, yes.
Yeah.
Just, you know, to keep me, because I'm walking off balance right now, you know.
Oh, yes.
So I keep going once a week so he can keep me
In line.
in line, yeah.
Yeah, exactly. So, Dr. Miller, exactly what was the, why was it so successful? Why did Julie see the relief that she did? You went through the DRX 9000.
Well, I would tell you she was a great patient, did what we asked of her too, so that's important. But, you know, we did what's called true non-surgical spinal decompression, and this is a medical device that you're watching here. Very specifically, through the aid of computers, we're able to help regenerate these injured discs, where it literally starts to draw those herniations back in off of the nerves and rehydrates these discs where they can start to thicken up and become more of a normal disc once again. And so, you know, we go to the source of the problem that causes the pain and work on fixing that to alleviate the pain. And, you know, she followed our instructions and just did very, very well. But it's non-invasive, so there's no drug shots or surgery involved. You really don't have to have downtime to heal. You can continue living your life. And I think most patients are very, very comfortable and relaxed going through these treatments.
And so if people are interested in getting that initial consultation with you, I know that you love to make the information available to people, and you're even now offering some of those workshops virtually.
Yeah, I do seminars often, but these days we're going to be doing a webinar. It's going to be next Tuesday night at 5:30 p.m. They do have to call our office or go online to register for that. But I'll be talking about a lot of these different conditions they may be struggling with, different treatment options that can help with those conditions, see if they're a candidate for what we offer at our office. But if they just can't wait or they want to get in and get checked, they can call our office today or go online. And we have a great special. It's $60 for a consultation, the examination, and a set of x-rays so that we can actually get down to the bottom of that and show them so they can see with their own eyes what's going on and why they've been hurting.
Yeah, fantastic. Thanks so much, Dr. Miller. Julie, I'm glad you're getting relief. Glad you watch 8 West to find our great experts here.